Hello, my name is Jacob. Today I'm going to be doing my sterile dressing change and sterile gloves. Um, I will be using my GPSPs. Um, First I would knock on the door. I would open the door, close the door behind me, close the curtain for privacy for my patient. I would introduce myself to the patient. Hello, my name is Jacob. I'm going to be your nurse today. I'll be doing a sterile dressing change on you. Is that okay? I would ask them to rate their pain. If they rated it a 0 out of 10, if they were having any pain, I would administer pain medicine using my 11 arts and 3 checks after I checked their allergies and to make sure that the doctor had prescribed pain medicine. But since they're not having any pain, I would not administer any pain medicine. At this point, I would perform hand hygiene, put on clean gloves, I would use the push-pull method to loosen the tape. If it was still, if the dressing was still stuck, I would use sterile saline to loosen it and remove it. I would then use the taco use taco to assess the dressing, which is type, amount, color, and odor. And then I would discard of that dressing. I would also, at that point, I would change my gloves, perform hand hygiene. I would gather my supplies. At this point, I would take an alcohol wipe, clean my work area, dry it off, and then I would put out my sterile materials, checking the dates to make sure that they are within, or that they're good, and they are. I would check to make sure that the packaging is not damaged, not wet, and that it's still sterile, and it is. So at this point, I would go ahead and open my sterile dressing change kit away from me, making sure not to contaminate it. At this point, I can go ahead and open up my gloves, doing the same thing, making sure that the date is good, which it is, making sure that the package is not damaged, not opened, and it's not wet, which it is, it's good. So I can go ahead and remove my gloves and dispose of that package. I'm going to go ahead and open this package, making sure to just touch the 1-inch border. Now I would take my non-dominant hand, pick up my glove, take a step back, and slide my glove on. At this point, I could take a step forward and pick up this glove with this hand, take a step back, and slide it on. At this point, I would get rid of this package. And I would reach into my sterile dressing change kit and pick up my cleaning swabs. Take one and clean down the center, disposing of it. I would take the other one, making sure not to reach over the wound, come down the side, dispose of that one. Clean the side closest to me, making sure dispose of it, dispose of that package. At this point, I would pick up a dry piece of gauze to pat dry, starting in the middle, dispose of it. I would then go around the wound, patting dry on that side, disposing of it. I would then pick up another one, patting dry, the one closest to me, disposing of it. And at this point I could go ahead and dispose of my tweezers. I would then take off these gloves, perform hand hygiene, open up my other gloves, checking the date, making sure that it's within range, making sure that the package is not damaged, not wet, not open, it's all good, so I can remove that set of gloves. I'll dispose of that wrapper and open this set the same way, making sure to only to touch the 1-inch border. At this point, I would reach in with my non-dominant hand, take a step back, slide on my glove, then I can take a step forward, picking up this glove, taking a step back, sliding it on. I would not adjust this cuff for risk of contamination, but I can adjust my fingers as needed. I would then step back into the sterile field and dispose of that wrapper. At this point, I would reach into my sterile container and get out my new well, before I did that, I would note the size of the wound, the color, if there was any swelling, any discharge, any redness, and at that point I would go ahead and grab my new dressing, apply it, go ahead and grab my tape, tape the bottom, tape the top, tape the sides, and go ahead and dispose of that, and then put my initials, the date and the time of the dressing change, dispose of this. I could go ahead and remove these gloves, and then make sure that my patient is comfortable, make sure their call light is within reach, clean up my supplies, report and record.